Thank you for joining us today. I work for an independent market research company. You should know that I do not make or sell any of the products we will talk about today. Please be as open and honest as possible with your responses. You cannot hurt my feelings or offend me in any way. Shall we begin?
Yes. Thank you for inviting me. I enjoy the opportunity to provide feedback on new medications in development.
Today we will not be talking about any new medications in development. The topic of today's conversation is the emotional needs of diabetes patients.
I am not sure I understand.
We will talk about what diabetes patients need from an emotional perspective.
Do you mean, like their HbA1c level?
No. We would like to gain a more human-centric understanding of the emotional journey that patients take with type 2 diabetes.
You do know I am an endocrinologist, right?
Yes. We are very interested in how endocrinologists consider the emotional needs of their patients.
That's not really what I do.
Well, let's start by thinking of a patient that you see in your practice.
I see hundreds of patients.
Well, how about one you saw yesterday?
I saw 29 patients yesterday.
Well, does one of them stand out?
There was a woman with congenital adrenal hyperplasia.
And why does she stand out?
Because she has congenital adrenal hyperplasia.
Is there anything less clinical that stands out about this patient?
She also has an underlying thyroid condition.
How about something that isn't a medical condition? Tell me something about her personal life. Does she have a family?
She has a pet dog.
Okay. That is a good start. Tell me, what kind of dog is it?
How would I know that?
When she told you about the dog, didn't you ask?
No.
So when she told you she had a dog, what did you say?
I told her she needs to lower her serum triglyceride level.
Let's try something different. I find it can be helpful to use imagery when describing a patient's emotions. Tell me this. If this patient were a tree, what kind of tree would they be?
You have got to be kidding me.
No. I would like to hear your answer.
I suppose you could say that every patient is essentially a decision tree, with branches corresponding to the probabilized outcomes of different therapeutic interventions.
I need a tree that grows in the ground.
Look, I am just not comfortable with this type of research. Usually I get to comment on some new product X. Where is product X?
I am sorry, we do not have a product X today. Please answer the tree question.
No.
Look. This is pretty simple. I am giving you 100% of the honorarium. And now you answer 100% of my questions.
I cannot answer this question. It is a matter of principle. If you want to ask someone about trees, you should invite a gardener to participate.
Please. Just try and do this for me. Close your eyes. I want you to think of the patient we discussed. Are you thinking of her?
Yes.
Okay, great. Now, I want you to tell me the first type of tree that comes to mind.
An oak tree.
Excellent. Excellent. Now tell me, why did you choose an oak tree?
Because it is really big.
Interesting. So what was it about this patient that made you think of a big tree?
Oh, it wasn't the patient.
I'm sorry? Then what made you think of the big oak tree?
Well, when I closed my eyes, I started thinking about a tree falling over and crushing you. I wanted to make sure it was a pretty big tree.
You were supposed to be thinking about the patient when you imagined your tree.
I told you, that's not what I do.